Amblyopia, commonly known as lazy eye, is a condition where one eye cannot achieve full visual acuity, even though it appears normal. This condition is significant because it affects around 3% of children, most commonly between the ages of 3 and 8. In amblyopia, the brain ignores information from the weaker eye, which can become increasingly weaker over time. If not treated early and properly, it often leads to progressive vision loss in the affected eye. However, with appropriate treatment, full eyesight recovery is possible in about 90% of cases. Early treatment, especially between ages 3 to 8, is crucial as the brain is still developing during this stage. The most common cause of amblyopia is misaligned eyes, also known as strabismus. This condition involves an imbalance in the positioning of the two eyes, causing one eye to cross inward or turn outward. The brain may ignore visual input from the misaligned eye to avoid double vision, leading to amblyopia. Another cause of amblyopia is significant refractive errors between the eyes. If one eye has a much stronger refractive error, the brain may start favoring the other eye, again to avoid double vision. A third type of amblyopia occurs when something obstructs light from reaching the retina, as seen in cases like congenital cataracts. Treatment for amblyopia is most effective when started before the age of 7. The primary goal of treatment is to encourage the brain to process visual inputs from the lazy eye. The first line of treatment corrects any underlying refractive errors, such as nearsightedness, farsightedness, or astigmatism, typically using eyeglasses or contact lenses. Patching, or covering the stronger eye for several hours per day, is another effective method. This forces the lazy eye to work harder and stimulates the brain to use the weaker eye, with an effectiveness rate of approximately 80 to 90%. Atropine drops, used in the stronger eye, cause temporary blurred vision in that eye, encouraging the weaker eye to work more. Atropine paralyzes the ciliary muscle, which controls the eye's focusing ability. This treatment is slightly less effective than patching, with a success rate of around 70 to 80% in mild to moderate amblyopia. It is often used when patching is not tolerable for the patient. Vision therapy or eye exercises can also be beneficial, with an effectiveness of about 60%. When considering the top 3 treatment methods for amblyopia in adults, they are as follows: low-dose atropine. This can be effective in many cases, even for adults. Atropine drops are applied to the stronger eye to improve the adaptability of the weaker eye. The typical dosage is 0.01%, with 1 to 2 drops in the stronger eye once a day, for a duration of 6 to 12 months. This treatment encourages the weaker eye to work harder, thereby improving vision. The effectiveness of this treatment is more than 70%, although the degree of improvement varies and depends on individual factors. Binocular therapy using virtual reality. This promising method for adults encourages both eyes to work together. It usually takes a game-like format, where tasks such as matching patterns, identifying objects, or completing tasks require the cooperation of both eyes. A well-known example of binocular therapy is dicarptic treatment, where the amblyopic eye is presented with a high-contrast image and the stronger eye with a low-contrast image. Both sets of image information are required to play the game or complete the task, training both eyes to work in unison. Neurovision therapy. This involves computer-based exercises. For instance, the patient is seated in front of a computer screen and asked to perform tasks that involve distinguishing fine details in patterns or images. These tasks are designed to be just above the visual threshold of the amblyopic eye, gradually becoming more challenging as the patient's vision improves.